So if we look at the medications we use to treat ADHD, we've got three medicines, really, two categories. We've got the stimulants and the non-stimulant medicines. In the stimulant medicines, we've got methylphenidate. We've got Ritalin slow release in Canada, Bifenton, and Concerta. I've put the Daytrana methylphenidate patch. That's the patch of methylphenidate that's available in the U.S. That was the company that markets that medicine and created that medicine has applied for approval in Canada, though they've put their application on hold. I don't know if we'll ever get that medicine in Canada. So if anybody's holding out for that, I just can't tell you we'll have it for sure. That's why it's in a different color. When it comes to the amphetamine medicines, we've got Dexedrine Spansules, Adderall XR, and Vyvanse, and the non-stimulant Strattera. These are the medications that we have in Canada right now that are officially approved for use in ADHD. This next slide, we look at the duration of action, and this is tremendously important. We look at, the Ritalin's 4 hours, Ritalin SR 6. Bifenton is approximately 10 hours and Concerta 12. The asterisk doesn't mean it's really special. I put the asterisk there to say that it's a sprinkle capsule. So for little kids who can't swallow, the capsule can be opened and sprinkled in a spoonful of applesauce or yogurt. So Bifenton has that. Concerta is a 12-hour medicine. For the amphetamines, we've got these medicines here. Adderall XR is 12 hours. Vyvanse is 13 hours plus. And these three here can be sprinkled. And then the Strattera, the non-stimulant, can work for up to 24 hours. So that's the duration of action, and this is important. And it's, some people often think that, well, if somebody went from Ritalin in the morning and Ritalin at lunch, if they take a Concerta first thing in the morning, it's just for their convenience, right? It's so they don't have to remember a pill in the middle of the day. Well, it's not just convenience. First of all, there are many kids who would get teased and bullied because they had to go to the office. The school would make the absolute unbelievable mistake of announcing over the overhead, come downstairs to the office, right? And the kids are like, go get your chill pill. Right, which can be absolutely devastating for a kid who's, really at any age in school. But there's also a lot more data that shows that with these long-acting medicines, people don't get the peaks and valleys of the medication concentration in their blood, so they get a much better symptom control throughout the course of the day. So these medicines work better. Now, remember I told you it was coming? The main point that I want you to remember, this is it, okay? So all eyes on the board. It worked. You see, I kind of primed you for this 20-odd minutes ago. Okay, so how to think about medications for ADHD. Now, I have to admit, on this slide, I put in a couple of the American medicines, but you can ignore those if they weren't on the earlier slide. Here's how to think about medicines for ADHD. There are 3 medicines for ADHD. They're marketed in different packages, like Concerta, Bifenton, Ritalin. They are all methylphenidate medicines, though they come in different delivery systems, right? Makes sense. There's amphetamine medicines. These are all very much the same. There's minor differences amongst the amphetamine medicines that if any of you are interested in, come up and talk to me later. We won't take the time for that now. But they're essentially the same, the amphetamine medicines, and then we've got the non-stimulant Strattera. So sometimes I get a referral from people, from a doctor or pediatrician, who says, please assess this 12-year-old with ADHD. He has done poorly on Ritalin, Bifenton, and Concerta. Please advise. Okay? So let me just point this out for all of you. Ritalin, Concerta, Bifenton. Okay? Let's just say these are my easier consultations. Because I can kind of figure out pretty darn quick, like maybe even before the person comes into the office, what I may recommend. What may I recommend? Right, trying one of the medicines in one of the other categories, right? Makes sense. So here's the finer point to this. If somebody's on Concerta and it works great for them, but they don't get to sleep till midnight, and this is really hard for a 12-year-old, what might I suggest? Take a shorter acting version of the same medicine, right? So Bifenton works a little less long acting, so maybe that would work okay, right? Now if they take Concerta and they have terrible side effects, terrible headaches, feeling awful, moody, crying, whatever the side effect may be, and they say, well, we heard about this Bifenton, somebody told us. Would I suggest the Bifenton? No, I'm not going to suggest Bifenton because it's essentially the same medicine in a different package. So then I would say, well, let's jump over to one of these, right? Let's either try one of the other stimulants, the Adderall or Vyvanse, or let's try the non-stimulant Strattera. And then the discussion becomes, when I say it's one of the easier consultations, it's actually a wonderful opportunity because now, I confirm the diagnosis, check for coexisting conditions, and take a lot more time to talk about how I can help them and educate them about ADHD. Though the recommendations, the treatment recommendations, you guys all know now, that decision can be made pretty darn quick. So when it comes down to it, for somebody to say they've got trouble with taking ADHD medicines, I use a very simple protocol. Have they been on at least one of the methylphenidate medicines at an adequate dose? Have they been on an amphetamine medicine on an adequate dose for long enough? Have they been on Strattera at an adequate dose for long enough? And Strattera really does have to be long enough. It's got to be at least 4 to 6 weeks, if not 8, to really know if it's going to work. So if they've been on all of those medications for long enough, then I have to look at secondary, so-called third-line medicines. If they haven't, it's very simple. I go back and fill in the gaps. If they tried Adderall XR but only got up to 10 milligrams, well, that's probably not enough. If they stopped it because it was pulled off the market in Canada, which was a fiasco and unnecessary, then we got to go back and try that category of medicines. Is that clear to everybody? So when a new medicine comes to market, the first question I want each of you to ask is, which medicine is it? Right? Because is it just methylphenidate in a new package? Is it an amphetamine in a new package? Or is it a non-stimulant? Now, there is a chance we may get non-stimulants that work in different ways. For example, Dr. Brown mentioned Intuniv. That is a non-stimulant available in the US that we don't have in Canada yet. Though it's still a non-stimulant, but it works slightly differently, and we'll talk about that in a little bit. But for now, keep this framework in mind. 3 medicines for ADHD, packaged all differently. Make sense? Everybody, you're going to remember this today, tomorrow, next week, right? This is in your head. 3 types of medicines. This is your big takeaway.